Hello, everyone, and good evening. So, this is the second webinar of the Roadway to Research series, and we have with us our distinguished speaker, Porus. So, just a bit of introduction before we quickly move on to his talk. Porus is a final year MBBS student at CGS Medical College and KEM Hospital, Mumbai, who has also been a former research scholar, come clinical observer at Johns Hopkins University School of Medicine in US. And his primary interest is actually obs gynae, and he is actually a student researcher with a very positive work ethic and has intricate knowledge of the research methodology along with the bioethics. So um, and additionally, he has served in various positions in various professional and community services, volunteering spheres. Uh, so, will not waste any time. Just moving on to his talk. Over to you, first.
Thank you so much for the lovely introduction. And as rightly said by the organizer, without any further ado, let's continue with the talk. I'll just share my screen. Just let me know if it's visible. Just give me a moment. Is it visible?
Yeah, it is.
Yes, yes.
All right. So, mm, all right. So, hello everyone. Welcome to this session, and I thank the organizers for inviting me to this talk. I am Pauras Mhatre. I am a final year or fourth year medical student in CGS Medical College in KM Hospital, Mumbai, and I have also been a research scholar and visiting medical students at the Johns Hopkins University School of Medicine in the Division of Reproductive Sciences and Women's Health Research in the Department of Gynecology and Obstetrics in Baltimore, USA. And my fields of interest are OBGYN, including sexual and LGBTQ plus healthcare, with special interest in integration with technology, public health, advocacy, and so on. And as rightly said, I've served various other positions related to advocacy, related to LGBTQ plus rights, related to mental health, related to medical education and foreign exchanges, and design and all of that. So before we begin, I just want to give a disclaimer that I'll try to make this talk as easy and understandable as far as possible. And I do understand that many of you all might be at the beginning of your interest in research, and that's why I want to make it as simple as possible. And it is being the second in webinar in the series as well. So I understand that you all might not have some orientation. So this talk of mine I have structured and tailored according to these aspects, and a lot of it I will be speaking with the objective or in the terminology which a lay person or a lay scientific person would understand. So pardon me if you all feel that I'm not talking very scientifically, but that's because so that everybody could understand. So moving on, uh, what is research? So can somebody in the audience, you know, mention it in what is your understanding of research? Anybody? It need not be exactly right or whatsoever, and any answer is understandable without any judgment.
Anyone?
I would like to say that research is when we investigate about the things that are unknown. For example, if there is a drug, then we can research about the unknown adverse effects of it. So that can be one aspect of research.
All right. That's a good answer. Anybody else also wants to try? I feel that we have a very diverse population in the audience, so please feel free to speak. There will be no judgment whatsoever. All right. So, moving on. Uh, so, do you all know this ad in Indian cinemas? Like tobacco
তাহলে
causes.
এটা
Once,
ওটারই পার্ট আছে
sorry, say again. Hello.
তুই শিওর এই মেয়েটা তোদের পাড়ায় ওই মেয়েটাই
I think he has unmuted by mistake. Uh, yeah, thank you so much for muting. So we do know for a fact now that tobacco causes lung cancer, but and we see so many ads in the Indian cinemas, theaters, about Mukesh, and on your packets of cigarette also. It's a very known fact that 80%. It's a guideline that 80% should be covered with a image warning. So, but did we always know whether tobacco causes lung cancer, or tobacco causes cancer, or smoking causes cancer? We did not, right? We are not born with the inherent knowledge of anything, but rather we try to find out and seek this knowledge when it comes to science. So, this is one of the earliest studies which found that tobacco causes lung cancer, or smoking causes lung cancer, by Doll and Hill, published in the British Medical Journal. And there were many contemporary researchers. In fact, one of the earliest researchers in this was in doctors who smoked, and it was found that it is associated, and hence, with further loads and loads of research, now we conclusively know that smoking causes lung cancer, or smoking causes, or tobacco causes oral cancer, and so on. At the same time, we also do know for a fact that smoking has positive, quote unquote, positive effect on some gynecological the diseases, because of the endocrinological involvement of it. But we do know for a fact that the risks and the harms outweigh the benefits. So this knowledge does not come randomly from anywhere, right? So that's where research comes into play. So as somebody rightly said in the chat, I think I'm not able to see all chats, and hence I would like to y'all, if y'all could unmute and speak whenever you want to speak. That research is literally two terms, re and search. I would like, in fact, just for a lay understanding, I like to see it as re plus search. Now, what does this mean? Re means redoing. But redoing what? And similarly, search. Searching for what? So, searching for the unknown gaps in knowledge. If we don't know something, we find it out. That is what research is. Research is like going into the dark jungle, wherein you are likely to find treasure, or the lack of treasure for the matter. But that anything gives you knowledge. Like, for example, an adventure, or a whatever you call it, Indiana Jones or whatever. When you go like in the search of treasure in a jungle, we either know that there is a treasure and we get the treasure, or else it gives what do you say? It gives an knowledge that there is no treasure, so there is no point of going again in that jungle. Similarly, So like today is Teachers Day, and I tend to one of the quotes I read a lot of motivational quotes. So it was like everything is a learning, even failures are learnings. So what like if we succeed, we know how to do it. If we fail, we know how not to do it. Similarly is the case of research. So it is knowing these unknown gaps or lacunae in science, or redoing, that is validating what is thought or opined, that is what you call as hypothesis. So just imagine, randomly nobody would have done this study of smoking causes lung cancer, right? It would have been somebody would have seen, or somebody would have thought, tomorrow I can also do a research think of like if I have any opinion for that matter, it's not that I could use it in clinical practice directly, right? So that is the essence of your evidence based medicine. That is, we practice medicine based on our evidence, based on what we find in research. So what we even if we have some opinions, we can't just practice it using those opinions. We have to find conclusive evidence using research before putting it into clinical practice. That is what based medicine is about. That is what research is about. Did you all understand what the basic concept of research is? I would like to hear some audience words on this before continuing.
This is an interactive session, so any one of you can actually unmute your mic and respond.
Please feel free to do so. All right. So moving on, let's take some examples. So somebody had asked in the registration forms, as in how to find research topics. So usually, uh, research topics are understood from the gaps in knowledge or gaps in literature. Basically, somebody I think asked a question even in the chat, what is research gap? So it's nothing like research gap, but rather I'll call it gap in knowledge. That is, knowing what is not known. All right, so that is how you find the research topics, and there are various types of ways of how you would find research topics. So the first, I'll give you some examples. All right. So once, I'm sharing this with consent of my mom that a couple of years back, my mom had abnormal uterine bleeding or heavy menstrual bleeding. Is uh, like for third years and fourth years, this might be similar terms. That is when you have a lot of pain, dysmenorrhea or pain, and a lot of menstrual bleeding, it heavily affects the quality of life. And then it was found that she had fibroids, but fibroids like sometimes fibroids are significant, sometimes fibroids are insignificant. But seeing that, I could like see, we the diagnosis till the end was not exactly known, but she did have some fibroids for which she underwent hysterectomy. uh, but I could really see how it affected her quality of life, till she had hysterectomy. And when she had hysterectomy, although she like for some days it was there was some post operative pain and all of that, but still she was in general very happy. Now she's so functional, like these are her own words, as compared to back then when she hated lying in the bed because of the pain. So this made me think of what could be the effect of fibroids on quality of life. And that's when I went to literature, and I was surprised to find out of how badly fibroids affect the quality of life of women with fibroids in general. All right, and then so many research questions came up in my mind related to that. If there was no study at all related to quality of life in women with fibroids, I would have done that. In fact, there is a one of the possible research topics which could be done is a systematic review of quality of life in women with fibroids or in women with abnormal uterine bleeding in India. All right. Some other example is my friend Nishika told me that in one of the hospitals, she observed uh, cases of how pregnant women who are at term or who are actively in labor are not treated well by some people, including physicians, not to reveal any names or whatever of the physicians or whatever. But that led me to think of how this might be a problem at multiple places in my hospital. As far as I've attended the labor room, I've seen really good practices both in KEM and Vadia LC. Or I don't know, I'm like just a final year student, but I really love the way how respectfully they treat. But that might not be the case everywhere. So I did find some two or three papers on how obstetric violence is a reality. It could be in the form of domestic violence by the family or the husband, or it could be the hospital based violence and so on. So a research is needed to look at obstetric violence. Or some other examples could be on Twitter, somebody shared their experiences of how they felt left out as a medical student, of how they felt socially isolated due to various social factors in medical school or medical college, whatever you all call it. So that led me to think of what would this be a problem in the colleges in general. How does it affect the students, how, like, who are targeted, or how does it affect the academic performance, how does it affect the quality of life and all of that. So a qualitative research could be done on this topic to understand the aspects of people who feel socially isolated or left out. Or for example, one of the techniques of finding research gaps is finding or reading papers. One thing which is important is you have to read consistently and you have to keep on reading. So recently in the journal, I keep on reading such journals, right? So in the UOG journal, there was one paper in March 2023, right now only, by Yagel et al., which you all must be knowing condition known as preeclampsia. That is when there is proteinuria in addition to gestational hypertension. Uh, so it is a serious condition and it has various poor pregnancy outcomes if not managed properly, and it could lead to further complications like HELP syndrome and eclampsia, which is addition of seizures to the group and all of that. So till now, like in pregnancy is very prevalent. Like 10% of all confinement of or admissions in the hospital are because of preeclampsia. So I read this paper. Like till now, it preeclampsia, if classified, was always classified as early and late preeclampsia. But this new paper by Yagel et al. In the UOG journal, Ultrasonography in Obstetrics and Gynecology journal, it suggested new classification, that is type 1 and type 2 preeclampsia, wherein the pathoetiogenesis, it is a pathoetiological basis, wherein uh, at one end in type 1 there is maternal cardiac dysfunction, and in type 2 there is placental dysfunction. So you all might want to read it further on that. So this is a very new classification which has been opined or hypothesized. So a topic strike my mind of what could be the possible pregnancy outcomes related to the preeclampsia, these types of preeclampsia, or what would be the what do you say, biochemical and pathological parameters or of investigations in these types. So this is how you all decide for types in general. And just give me a moment. I had some more topics for you all. Uh, uh, just a minute. Yeah, and yeah, in one of the neighbors, I checked that I found out that vaginal steaming or vaginal smoking is a thing. So research could be done on that, or like I'm very enthusiastic about medical education and this new CBME curriculum which has come in India, and medical ethics and all of that. So effect of CBME curriculum on knowledge, on experience, or EdCom on the practices of Indian medical graduates, and so on and so forth. So I have more research topics which I could think of, but because of the concerns of confidentiality which I have for the ongoing researches, I can't share those. But these are the topics which I could share, which I have not started yet. But these are just some random thoughts, as I said, which I saw on daily basis, which I saw on what do you say, by reading journals, by reading on social media, like some learnings from social media, or what do you say, mentors ki batti jali type of a situation, or on social media, through social media experiences, or your textbooks for the matter. And in fact, I'll say that such gaps in knowledge, that is what is not known, what is unknown, is also quite frequently told in the form of limitations of the study. When somebody is, what do you say, in papers, in the discussion section, usually investigators write limitations of their study. So if you can improve on those limitations, that is also how you find research topics. And in fact, like one of the topics which can be told is, if I wanted to see the this is a very awesome initiative which Games West Bengal chapter has undertaken to share research experiences and guide through the journey for young researchers. But uh, I feel it is awesome. But is it really awesome? Is it really effective? How would I know? So what one could do is take a pre and post test or exam, or check whether people are actually doing research before and after, and that will determine the effectiveness. So by paper, by evidence, we could conclusively say of how effective this whole series is. That is how research is done. Did you all understand what I'm trying to convey?
Yes.
I'm sorry, I'm just going fast with it, but yeah. Um, Somebody raised their hands. All right, thank
Yeah,
you.
continue, continue.
Yeah, yeah. Thank you so much. So, so coming to the further topic of, like, I have thought of this as random topics, but how do I really select a research topic? So there are certain criteria of selecting research topics. Um, Somebody has raised their hand.
Yeah,
Nico,
Satyam, you can unmute.
do we have any questions?
Okay, you can continue.
All
Continue.
right. So, but it is not right to just take any random topic and do research on that, right? Means like tomorrow anybody could. I would like to do a research on how many number of what is the number of chairs in my house, and publish it. that does not make sense, right? I mean, like, what is going to be the use of it? Or tomorrow I might want to do a research which I invent a new technique of, I'll say, I invent, let's say, random diffusion tensor imaging in diagnosis of what do you say, endometrioma or your chocolate cysts. That sounds weird, right? That does not sound scientifically sound. Or I might want to do a research tomorrow on say uh, mm, some new what do you say, surgery which I thought of, and I don't think that is feasible as an undergraduate student for myself, right? And for most of y'all. So there are various factors which we have to think. Or tomorrow I might want to do a research uh, which takes all prisoners only and gives them a certain vaccine to check for its efficacy. Only prisoners. That does not sound very ethical to me. All right. So similarly, we can't just go randomly and do research just for the sake of it. Every research has to have, so like, while selecting a research topic, it is necessary that you all look into certain research criteria or criteria for selecting a research topic or question, which a very commonly used acronym is the final criteria. So what does it stand for? F stands for feasible. That is, every research should have an adequate study design. I can't do like you all must be hearing about the Framingham heart study, which has gone for years and looked into the cardiac health or cardiovascular health. But it is a prospective cohort study. I, as a UG student, might not have the adequate resources to follow for years, for 20 to 30 years, or I might not be able to study unless I have resources. So research study design or the study type has to be taken care of. Do we have the adequate funding? Tomorrow I might want to do an interventional research about a drug trial, but I don't have enough funding or the qualifications for it. Or the target population, do I have the reach to that population? For example, if I want to do a study in LGBTQ plus population, since it's my area of interest and I have developed, contacts who could, how I could reach the population, but not everybody could reach the, population, and so on. So target population should be accessible and it should be feasible. Then, for example, somebody in a peripheral institute might not get many referrals of press like syndrome, or probably something like splenic piliosis, or something like your Pauras syndrome. These are some very rare diseases. So, do you have the reach to that population? Is it feasible to do that do research related to that population? Sample size should be achievable. These are, although this is a lot of jargon, sample size and all of that, I would have loved to explain what it is. But basically, it's to say in very lay terms, it is the number of people which we include in our uh, research study. And I build, but this the details of it is the out of the scope of this webinar, so I will keep it for some other webinar. And do we have enough human resources? Do we have enough technical resources? For example, I'll share honestly that a couple of years back when I went to AIMS, I felt a little, what do you say, insecure, because people there do a lot of research related to immunohistochemistry. That kind of resources, technical resources, might not be available in full-fledged sense in KEM, or unless it's a research study or whatever. So there are various aspects, and whether you can manage the dropout rate, whether you could complete in what do you say in the appropriate time frame. So in general, a study should be feasible to do. All right, possible होना चाहिए. If I have to speak in Hindi, but then it should be interesting. See, if tomorrow, if you are doing a research, let's say, let's talk about me. I have an interest in OBGYN and all of that. I don't really have interest in neurosurgery. It is really not my thing. I am not a very big fan of neurology and neurosurgery. But of course, I studied as an undergraduate medical student, but I might not do research on, let's say, uh, glioblastoma multiforme and all of that, because it's just not my interest. And the investigator, moreover, the primary investigator, principal investigator, and the person looking over the research should be interested in it. Otherwise, the study will stop in between, right? And it should be to the interest of the peers. Like you are doing this research, let's say in OBGYN, uh, it should, like, for example, if I write on fibroids, people might read it because it's a common thing, or if I write something rare, people might read it. But if I want to like see OBGY women's health, right? If I do a study on what do you say, how many percent of women cook in their kitchens, that is not first of all, I'm not like, I don't know, this is a very random topic, but that is not a very interesting topic, and there are many issues with that as well, right? So there are many aspects to this. It should be interesting to peers, and for this I will urge one thing. I'll say that please make it a point to go to your faculty and talk with them. In KEM and in Vadia, OBGY, I have so good faculties in OBGY who I could go and talk to, and like, I could, like, some may be doing research and some might not be doing research, like not active in research, but still they have vast clinical knowledge, and ultimately research is done to improve clinical practices. So a clinician can give you the important points which you could you know consider to select a topic. So I have been blessed in that sense. And I believe a lot of y'all, it's a matter of reaching out. If not in your institute, many are available on social media. You all can, many are reachable through emails or attend conferences. Like I recently attend the American College of Obstetrics and Gynecology conference, and the insights I got there, and uh, uh, the research which was presented there, and the speakers there, I could talk to them and like really understand what is the need of research and what are the areas in which research could be done. Similarly, it should be attractive to the readers and the community in general, right? And then it should present a different perspective of the problem. Next is N for novel. That is, novel means new. Something new should be added to the current knowledge. As I said, either like you have to find the gaps in knowledge. A research might have told something, for example, A is associated with B. Smoking causes lung cancer. We did not believe smoking causes lung cancer right back in 1950, just based on those two studies of Doll and Hill, and one another, I think Mueller studies and all of that. Only after years and years of multiple researches that when we believed, and a good external validation of the findings was done. All right, similar. So any research should either confirm the findings or refute it. That is, there are things like negative findings, or if your research, if you're thinking that, let's say, uh, um, for example, no, if I remember, just to give an example, on social media nowadays there is this, craze about semen retention and how no masturbation, leads to better physical outcomes and all of that. But this is a document which are, I would like to study upon and see whether it's just what do you say, opinion, or it's actually the truth. Or if a researcher ABC says that conversion therapy is effective in LGBTQ to change sexual orientations, if another research finds out that it is not the case, it could be done to refute the finding. That is, refute like or say that these findings are wrong, and this is very essential because tomorrow you might what do you say? For example, morcellation was something which was newly found, right? But recent what do you say? Researches and evidence has shown how it might lead to poor gynecological outcomes, including things like benign metastasizing leiomyoma, random or it might some bits might be left which might turn to leiomyosarcoma. So this kind it resolves your research should have something on the all right, and it might be a new country. It might, like basically, if a research is done in USA, you might do it because population is different in India, so you might want to do that, or else you might the gender might be different, or the city might be different, or a new technique you all could research on. So basically, there should be something or the other new. All right, but that's what novel means. Then it should be ethical. Now, the ethical word is self-explanatory. That is, tomorrow, like you should do, in bioethics. Like I think all of us, I have mine is the first ABME batch. So since I have reached final year, I'm talking about Indian medical students. I believe there are students from Pakistan and Bangladesh as well. But in India, like I think now all the batches currently, except the intern batch, has EdCom, Attitude, Ethics, and Communication. So I'm not describe that in detail, but basically it should be ethical. And since we are falling short on time, I will go ahead with it. And lastly, it should be relevant. It should generate needed knowledge. Assure and highlight needed. That is, you have to think of the impact. You have to think of the implications. Like basically, what will be the use of this study? Like as you said, finding the number of chairs in every household probably might not be a good research, but finding the number of toilets in each household will be a good research from the public health perspective, because toilets and the types and the size and all of that are important from public health aspects. So this is what the final criteria is for y'all. All right, and uh, to basically what I'll say is go crazy, think of random things. Like tomorrow, I may think of a topic about does my let's say Corynebacterium diphtheriae uh, causes malaria. For now, it might sound crazy. For example, I'm just giving a random example. But back then, when we did not know anything about either of malaria and diphtheria, or the diphtheria microorganism, a research would have been fine to do on this. Similarly, like be crazy, be innovative. Look in your wards. Like patients tell you what the problem is. Nurses tell you what the problem is. Your faculty, your physicians, your clinicians, your surgeons tell you what highlight what the problem is. What is important is to stay uh, in touch with reality, in what do you say, to know what the perspectives and what the felt needs are, and do the research accordingly. All right, so this is how you come up with research topics. Any questions before I move on? Am I audible?
Yeah,
Yeah. Can I move on?
yeah, you can move
Yeah.
on.
Thank you so much. So study designs. So what are the types of research? So, due to the lack of time, I will avoid. And To be honest, study designs is kind of out of the scope of this talk, because study designs really needs a separate talk and webinar altogether. But because it's an introduction section and introduction session, so I will just touch upon briefly. So imagine a building. There is a gold treasure on one of the buildings on the top floor. How would you get it? uh, so can I have some voices from you all? Just be crazy and think of various possible options of how you would get the treasure. Just give it a try. So myself, I would like go from the ground floor. I will go to the use the stairs, go to the top floor and take the treasure. Does somebody have any other ideas on this?
Take the lift and go up and get the treasure.
All right, that is a wonderful answer. Any other techniques you all might think?
Jump from the top of another building to the top of the building which has the treasure.
That is amazing answer. That is very smart. Because let's say, what if that building ground floor is locked? So you will go with the other from the other building, for example, right? Any other options? Use an airplane. That's a good answer. I mean, if you're recently seen Pathan and all of that, if your answer is motivated by that, all right. In like I'll just tell you one of the interesting answers which I got in a very recent teaching session which I took. One of the person said that he will bomb the building and the treasure will fall down and he will collect it. I was like, wow, that's crazy, but okay, fine as an answer. So similarly, to find something in research, there are various methods possible. You can prove the same point using various methods or various routes, and these types are called types of research studies, or in more scientific terms, we call it study designs. All right. So basically, how do you find, or how do you contribute to evidence, or how do you contribute to research and the scientific knowledge? So broadly, like, trust me, nobody will give you this flowchart, because nobody people forget basic sciences and translational research. But yeah, and this is a very what do you say, broad chart. There are minor detailing of each, but biomedical research can be classified as basic sciences or translational research. It could be original or clinical research, and it could be secondary research. So what do you mean by that? Firstly, basic sciences and translational research. It includes your laboratory experiments, it includes your health economic studies, it includes your feasibility studies, animal studies, cell lines, and in silicon computational, and all of that. So basically, you all remember in the 11th and 12th standard, you all did experiments, so-called experiments of Ohm's law, wherein you had apparatus, methods, and observations, interpretation, conclusion, etc. So similarly, lab experiments could be done in the field of health sciences, and if they're in biotechnology or basic sciences students, or even people in preclinical fields, lab experiments are something which could be done, and which are highly motivated, because unless we have the foundation, we can't go and find out actual research on like findings in humans on that. So you all can see, like, there could be health economic studies, like, cost utility or real world data analysis and all of that. So those are your basic sciences and lab experiments. And similarly, you have translational research. So I want to talk a lot about that, but translation is basically using your knowledge in one type of research and translate it to a larger field. For example, you might find that, let's say, uh, I'm able to think only of, let's say, cervical cancer. Already it's such a big problem. So you might want, if your basic science research back then a few years ago, if it told that the invasion of human papilloma virus, certain strains of it causes DNA mutations in certain cell lines, then you could do research of association of HPV to what do you say, in humans, or find out a vaccine based for those viruses and see whether they're in humans, and then to, like in normal healthy humans, then translation to patients, then to clinical practices, and then to community. So now HPV vaccine, for example, is at the stage of translation to the community level, where or practice, it's between T3 and T4, where we are promoting HPV vaccination right from the age of 12 years and so, or so, or like new researches are coming that previously it used to be told that it's not useful in people who are already sexually active, but now researchers are telling that based on research we have guidelines that even sexually active people can take HPV vaccine. So this is what translational research is about. Similarly, there is original research, which could be observational and interventional. Basically, are you purposely doing anything? On purpose, if you're doing something, if you're changing their routine, if you're changing something, that will be an interventional study. Whereas, otherwise, it could be an observational study where you just observe. The word is rightly saying that you're just observing, you're not doing anything. So I'll just skip the slides if the organizers are okay with it because of the lack of time. But there are various, study designs like case reports, case series, cross-sectional surveys, cross-sectional analytical studies, case control cohort, and some hybrid studies and all of that. Similarly, for interventional, you could have randomized and non-randomized studies, of which you all might have heard about RCT, that is randomized control trial. I would really like, because of the lack of time, I'll skip through this, and it is important like to have a different study designs session altogether. But there are such various types of original research. Whereas secondary research is basically you it's like you writing an essay based on public, knowledge that is known, evidence that is known, on based on the current publications. That is, you write literature reviews. Like for example, now we know that for example, uh, let's say, can anybody unmute and just say any field of their liking, just any field of their liking? Riddhi and somebody, it could be anything, and any disease of your liking.
Neurosurgery.
Neurosurgery, okay. And any disease you all might okay,
Marfan
rheumatology.
syndrome.
So which syndrome, sorry, say again?
Marfan syndrome.
Marfan syndrome. All right. So Marfan.
Acute tonsillitis.
All right. So I'm getting many topics, right? So acute tonsillitis, let's say ENT, and I'm more. I'm not a big fan of pediatrics. I'm just happy till neonatology. Sorry, like but yeah, I should need to know everything. But the thing is, all right. Let's say new acute tonsillitis because I'm done with ENT. So acute tonsillitis might, there are multiple complications related to tonsillectomy. For example, there could be a primary bleeding after a tonsillectomy surgery, but not all. One like you don't. For example, tomorrow, I think Raju said that, right? So tomorrow, Raju is a big otorhinolaryngologist or ENT surgeon, and patient named Ruben goes to him, and he's posted for a tonsillectomy operation. all right, based on the indications. So he's very worried because he has heard from many people that, oh my god, there is a lot of bleeding after tonsillectomy and all of that. So he asks Raju that, what are the chances of bleeding or so on. So Raju does not Raju does not have information right in his brain. So what does he do? That he goes and searches internet. But a study probably done, I'll just take random names, by Riddhi. Say the study done by Riddhi says that in 2% of the people who undergo tonsillectomy, they have primary bleeding. Whereas in a study by Shikhar, it is like 5%. Whereas in a study by uh, Ali, they might say that it is close to none in males, but around 5% in females. So you have various numbers which are available on even in researches. So what you do is you find out and all the studies and do an analysis of this published research. So you do a secondary analysis of this published research, which will be called as literature reviews. And there are types in that known as narrative review, systematic review, and systematic review meta-analysis, which it's again difficult to explain in this short span of time. All right. So there are various study designs, right? But each study design has some pros, has some cons. For example, your longitudinal studies, cohort studies are longitudinal. You have to follow them up. Or your cross-sectional studies are easy to do, but you can't find causation in that. In randomized control trials, you have strict control settings and you can do the comparison and check the efficacy. Whereas each research has some own investigator bias. So your systematic review is can possibly kill that bias, but it is so-called difficult to do. So this is the evidence pyramid, which tells you what is the quality of evidence. That is, expert opinions are the least. What do you say? It is a good marker, but in terms of evidence, quality of evidence, it is at the least. Whereas systematic reviews and meta-analysis give conclusive evidence, and which is at the top of the pyramid. And this goes into the formation of guidelines which are made by different societies, like American College of Cardiology, or International Federation of Obstetrics and Gynecology, or FIGO, or Indian, that is FOGC, Federation of Obstetrics and Gynecology Societies of India, or MOGS in OBGYN, or American College of Rheumatology, or your Indian Psychiatric Society, and all of that. So the guidelines are made based on this, systematic reviews and all of that, and also like basically whatever available. Wherein, because of the risk of bias means wrong findings, or uh, uh, basically factors affecting the true nature of the findings reduces, so quality of evidence increases. All right. But what do I choose? There are so many options, right? In study designs. So there was this so many questions on, how do I choose study designs? So the answer lies in, so uh, your, like, my screen is clearly visible to you, like, so it depends on a lot of things. Firstly, your experience as a researcher. All right. See, to like, I did not start randomly with doing, drug trials. In fact, I have still not done drug trials per se, right? Then it also, like, your study design and your field, your study topics also, your field of interest. You know, as I said, I might not want to do a study on neurosurgery. I will do it on obstetrics and gynecology. I would do on sexual health and all of that. And whereas in fact some fields you can't do all study designs. For example, if I want to do research on transgender health, uh, I'm not sure how feasible it will be to do all study designs. Similarly, the experience of the principal investigator and other teammates matters, or the strength of guidance available. I mean, see, me or anybody, we as UG students cannot be principal investigators under the ethical guidelines. Uh, in different institutes is different, but at least in KM, and that's how actually it should be according to the ethical guidelines set up by ICMR and all of that. Uh, Only people who are qualified, that is, who have done their PG in that who are registered medical practitioners and are faculties in that department can be principal investigator for KM IEC. All right, but whereas some other institutes might allow students as PI, but there should be a faculty guide and all of that. But ideally, there is some PI or guide in your research when you do research as a UG student. All right, so how involved and how experienced is that PI? Like, see, usually guides could be ranging from positive experience to negative experiences. So positive is when like, as I have had my mentors who are very enthusiastic and guide you on exactly how to do research. But there could be neutral guides where they will give you science and let you do whatever you want. But in such a case, you should be smart enough to or have previous experience of doing research, or some of your what do you say, uh, co-investigators, or your teammates should have experience and knowledge of how to do. And similarly, how much is your role in the study? Like, if you're alone in the study, thinking of doing an interventional study by yourself in a sample size of 200 or 300 per group is kind of foolish, because you probably cannot manage so many people, right? So as I said, you should have enough people, human resources, and you should find out what you say, choose a study design accordingly. How much time do you have? See, I probably cannot keep on doing 20-year research while being in KM, because I might, like, I don't know how much time I'll be in KM. And if it's initiated by me, if it's initiated by faculty and I'm just joining it, then it's fine, like, as somebody to collect data or something like. And that is another factor which you have to take under consideration, that is this research being started by you, or is it being initiated by a faculty member who is themselves enthusiastic about it and who will keep it on running for whatever time. And basically, how much time you have available. Like, I have heard so many excuses, and I'll call them excuses at sometimes and genuine reasons at sometimes, that some say there are exams, some say there are this fests and all of that. So you should not take the research if you're not able to complete it, is what my point is. And the resources available, for example, as I said, I might not be able to do immunohistochemistry in KM and electron microscopy and all of that. So, however, in general, it's better to go with the logical flow of complexity. Like, start with firstly, please start with reading the basic research methodology, and then get your feet dirty in the water. Like, start doing research, because don't wait till you master the theory of it, because practice makes human perfect, right? So when you start doing, you will start learning about things like biostatistics and all of that. So start with descriptive studies, start with online surveys, then go for offline, then go to analytical cross sectional. Then you can go on to, as ever, like, however you have guidance, and however risks you want to take, like, you can go for cohort studies or interventional studies or secondary research. One important point I want to highlight here is interventional research is possible at UG level. So people ask, in the next slide, for example, it has been asked, like, what the research do we do as a beginner? I've answered that question, but remember that some people tell that you cannot do interventional research. But many people confuse interventional research with your drug RCTs or vaccine RCTs. Of course, you can't do drug trials because these are pharmaceutical company initiated and they need qualified. See, experience is not enough at times. You need qualifications because you are the person responsible for people's health. Remember, there might go be, there are risks in every study. How much are you accountable? So probably you might not be involved in drug trials, but you can do randomized control trials of something like psychological interventions or public health interventions or preventive interventions. Like tomorrow, I could do a study, interventional study of two villages, wherein one I educate about what do you say, compliance to iron folic acid, and one I do not, and see the efficacy of this public health intervention, for example. And but in general, go with the flow of the complexity and don't rush, but also don't be scared to put your to get your feet dirty. Similarly, another question I got: maximum value for the CV. If you all remember the final criteria, and this like when you're talking about the CV, it's dependent on what you refer to as CV. Like, to be honest, on in Indian scenarios, you don't need CV for your admissions into your PG, but you need it for getting a permanent position as a faculty, not contractual, or for your promotions and all of that. And the criteria for that is different. Like, it should be indexed, and till a year, few years back, it allowed only first author and then like three authors and only. And there are various criteria of NMC and MUHS and all of that. Like, your universities and all of that. So that is a whole different thing together. But talking about USMLE or PLAB or all of that, usually people see the impact of the research. They don't see the type of research necessarily. It should be like you should have a good research with a good research question, preferably first author, wherein it is shown that you have had active role in the study and you know how to do research. So that is how first authorship will tell you. Or if not, the and most importantly, it should have public health impact. It should not public, like either public health or clinical impact or implications, and that will have maximum value for a CV. Initially, it won't matter whether it's what type of study. Let me tell you that a lot of people look down upon this Google form surveys and all of that, but remember, Google form surveys have been published in NEJM, that is one of the and Lancet and British Medical Journal. Like, these are one of the topmost few topmost medical journals with highest impact factors. And if they can accept Google for form service, so it depends on what what change are you bringing to people's lives, right? And similarly, clinical case reports, yes, they will reflect well on your CV. That is considered as a publication. And what research type do we need for ICMR STS? Anything works except for interventional studies. But make sure that you can complete it in 2 months, because they have all the instructions given on their instructions brochure. And yeah, so interventional they don't allow, they allow observational, and you should be able to complete it within 2 months or so. All right. And as a third year MBBS student with no prior experience, I have answered this question. But also take into factors a lot of things, like whether what's your exam scenario, if you're USMLE or PLAB student or whatever. All right. So I know this sounds difficult. And research in obstetrics and gynecology, it's very important, I'll say, and I will not use up a lot of time because I have been talking about OBGYN all along, right? Because I love OBGYN, but I'll just say that please, those who are interested in OBGYN or find it interesting, please do try to take it up as a field. See, I don't have a experience as a clinician or a surgeon in OBGYN, personal experience, but for the matter of fact, I do know that uh, research in OBGYN has been ignored as a field. and people have done wrong, what do you say, unethical researches and all of that. In fact, the very famous Sims, you all might have heard Sim Speculum and all of that, under his name. He has been known to perform some surgeries and all of that very unethically in women, in specifically black or African American women, and so on. But the point being, research in gynecology is still developing, and the advanced research is a need for the field. So please take it up, and let women's health not be an ignored field. And so, please do something for OBGYN. I'm trying my best. Let's see what the future holds for me as well. Similarly, diversity, equity, and inclusion. See, we as people have so many factors, and we, people are minorities and vulnerable in so many aspects, and hence it is very essential that we I have been trying to do so in whatever capacity possible. I have my good friends who have actually worked in poor, what do you say, less served areas where there's less healthcare access in various countries, India and Pakistan and so on. I think Hajra is here. She has done very wonderful job, and thank you so much for all of that. And so, people are vulnerable. People because on the matter of their race, class, language, culture. So one thing you could do for that is open public health advocacy, or you can do it by research. So some research, for example, this research showing how people don't have health insurance based on rural, urban, or geographic divide, or as gender. Then there are some gender disparities in eye care health. For example, this topic tells about how transgender people and commercial sex workers do not have access to eye care, or racial disparities, how maternal mortality is very high in black or African American women. I have tried to keep it Indian scenarios for the most, but for race, I'm I had to take this example of this study. Then sexual orientation, of how people don't get healthcare access, or how prisoners don't get access. Social disparities are there, right? So this prompts us for doing public health and advocacy in medicine. It could be in form of research, where we have to be very straightforward and very scientific, or you can go and talk about in open. And for example, researchers by the great Abhay and Dr. Abhay and Dr. Rani Bang, who have done a great research in tribal health, and for example, home-based neonatal management, home-based neonatal care. You all might have been studying in community medicine and preventive and social medicine or public health about how it has been a game changer, or how casteism affects people in India. Or it could be through your what do you say, societies like ACOG. Recently, the Supreme Court of recently, as in it has been a year actually, that it has it overturned the Roe versus Wade decision, creating a lot of problems in abortion access. So you could do it through your what do you say, national organizations, which even in India we do a lot. uh, and I have been involved in some organizations like that. Or you could do it on personal personal basis, by talking to your local politicians, approaching them, and there's so many matters. And hence advocacy in medicine matters, because people matter. And these are some insights I wanted to give. Like for example, IPS in India spoke about how conversion therapy is not ethical, is a professional misconduct. And the last example I wanted to give is by Dr. Bavaskar. Remember, for research in India, like people say that research is very difficult in India, but I will say research is very, very possible in India here, because even the orphan diseases, that is the rare diseases, because of a huge population, we see so many. Like the other day, I attended a webinar, and the speaker gave their example that there might be 100 cases of spinal muscular atrophy in Japan, which is very rare. It's called an orphan disease because of how rare it is. But in India, we find so much, like, like probably you might find thousands and 10,000 cases, and you might see. So because we have access to that population, so it is our duty, responsibility to do research with the population and not treat them as guinea pigs, but do with them and for them, so as to increase or enhance the healthcare outcomes of these. So this is all I wanted to say. I know I overshot the time a lot, but we also started late. So thank you so much, and I would love to answer your questions.
Thank you, Boris. It was really a very wonderful session of talk, and you shared insights on so many vital aspects, and especially where we have our participants who might be beginners in research. And overall, it was a great talk. We might have a few questions
Yeah, sure.
here.
Please do ask. Uh, till then, if these are my email ID and social media links, as well as a QR code for of the link tree. Feel free to reach out for whatever, and I can try to help in whatever capacity I can, uh, and so on. Thank you so much. Please do ask questions, and I'll love if somebody has some practical questions which I can answer.
Okay, so our first question is how can we differentiate between a systematic review and a literature review?
So. To be honest, like, to be very frank, this should be a topic for another. Study design should be a topic for as a separate topic for a session. But to say, in short, is that systematic review is, as it says, it is very like systematic and is very systematic, where you have predefined exact what do you say exact inclusion and exclusion criteria, so that we make sure that we include each and every research available on the internet, and we use those inclusion criteria and screen them for their eligibility. And it's a basic there it has a standard flow of how a systematic review is done, so that, and systematic review has higher quality of evidence than literature or narrative review, because systematic review makes sure that everything is included. It assesses the bias, that is, what are the limitations of the study, and it qualitatively sees for the quality of each research included, and whether all researches are included, and accordingly, what do you say uh, objectively specify what the collective evidence is, like what the collective findings of all this 20 to 30 or maybe hundreds of researches are. And it has to be it has specific research questions to answer, like, as I said, what is the chances of bleeding after a tonsillectomy in adolescent population. It has to have specific picot format. Again, I don't want to use research jargon here, but it answers specific questions, as against a narrative review faces limitations, that it is not bound to include all, but it is still has to be done in a very organized fashion. So that is how I hope that answers your question. And again, a special session is required for that.
Yeah, I agree that a special session is required for that. So, our next question is ICMR project possible in the first year of MBBS, and how to manage studies along with it?
Yes, it is very much possible. It is possible. I'll say it is possible. Uh, but sometimes it depends on, for example, last year students in the first, like, basically the 2022 batch were asking me, about they wanted to start a research project, like, they wanted to do a research for ICMR STS, but they had joined in November, and the deadline for submitting ICMR proposal was January 15th, I believe, or something like 12th or 17th. I don't remember exactly. And and when they approached, it was already the 1st of January or something, and it's kind of little you should know research methodology to begin with. Basically, you should know how to do research, or you should have enough guidance to begin with. All right, now since people have joined now pretty early on, you all could really do research in the first year, and of course, it's supposed to be a guidance thing. So choose your mentors appropriately or guides appropriately, and it is very much possible. And what do you say? And studies are very much manageable. It's all about time management, I will say.
Great. So our next question is, what all things must be included in the abstract of the research paper? So a bit of technical question, but
Yeah, sure,
you
sure. I
can.
don't mind. So see, again, there is standard. As Rohan has rightly answered, I believe, like there should be background, methods, results, and conclusion. All right. And if you're talking about abstract of a research paper for publication, like of abstract of your manuscript, which you're giving for publication to a journal, every journal has their own guidelines. All right, but usually standard is like your IMPAD format. All right, but if you're presenting or if you're submitting to conferences for presentations, they also give you specific what do you say guidelines on how you should prepare your abstract. And for in both the cases, it's they mention about the word limit, they mention on exactly how they want. So although the usual thing is background, methods, results, and conclusion, from practical experience I'll say that always adhere to the guidelines which of the uh, wherever you're submitting, and that will lead to better results, better outcomes of your submission.
Uh, we have our next question. Research article and thesis, is it the same thing? Um, the
So there is slight differences. So for a thesis, you do a research, but not every research is a thesis. All right. So thesis is usually done for academic purposes, like for your getting your master's degree, or getting your like for under your completion of your what do you say, post graduation or specialization or residency or your PhD. There you do a thesis for academic purposes, which has to be in a more detailed format. All right, and it has to have a very detailed section on literature review and so on. But it is still a research. All right, but not all research are thesis. So that is how I could tell in very simple terms without using the research jargon.
okay. Srijan, you have a question. Would you mind
Yeah.
unmuting yourself to ask?
By the way, I have my
Uh,
chat open. So yeah, if you can speak out, yeah, you can ask so it would be more personalized.
Yeah, you
yes,
can
am I
actually
audible?
unmute your mic.
Yes, 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 you
Yeah, am
are
I?
audible.
Yeah, so I just wanted to ask, like, if we are doing a research with a group or even under, for example, ICMR, then we can understand at various points in time if we're taking the right path or not. For example, if I get selected in STS, that means my topic selection, my methodology, everything was like fine, everything is right. But if I'm doing a research alone or with, for example, a group of people who are not so experienced, how do I
Yeah.
realize if I'm doing the right thing or not?
Yeah, so hence it is essential to have somebody who is experienced in the group. Like, at least, at least either the faculty guide or take somebody senior who is experienced to guide you in the research. And at times it now, like, it depends on what the senior or what whoever prefers, that she or they might be a part of the research team, or they might not be. But you could talk to them to see whether everything is going on correctly. And this is one point. Second point is that please approach your faculty. I mean, they are very again, uh, your question is more research based, so like for research aspects, talk to your faculty who are experienced in research, and they will guide you uh, through it. And the third point being, usually it's at the beginning of the research, wherein see, every research cannot begin with without ethics like any original research cannot uh, begin without a ethics approval. And for the matter of fact, it cannot begin without making of a protocol. And what is a protocol? It is a blueprint of what you will be doing in your research. So when you have your protocol ready, and all your documents of the research ready, you know exactly how to do. And hence these ethics committees are essential to help you, like to point out if there is any problem with the scientific quality of the uh, research. Because remember, bad science is unethical. So y'all might think that ethics committees should only look at ethics. That's not the case, because this research which you'll do, if you do it using wrong methodology, using biases and all, with a lot of biases, and then publish these results, it will have a bad outcome on the patient life and patient health. So hence the ethics committee will point out if your what do you say, scientific rigor of your protocol and all the documents is not correct. And hence, while making the protocol, take guidance. So as to answer your question, like to sum it up, you should do with somebody who is experienced, or you should take what do you say, consult somebody who is experienced, even if not including them in the team.
Right. Thank you so much.
Yeah, and in fact, to add on, like for example, some colleges do have this protocol discussion clubs and all of that, or peer to peer discussion clubs, where you can discuss with people of your proposed topic and all of that. And please remember, in research, trust me, you might think that you have thought a very novel, out of the world topic, but trust me, it's never that only you have thought. At least 100 people in the world might have thought on it. So don't be scared to share topics and to seek guidance, with the fear that it will be so quote unquote copied and all of that. Please freely talk about it. But when you begin, you might want to be confidential about the findings and all of the study, which is okay. But about the ideas, if you need guidance, you need to risk it, I'll say. Then is your question answered, Srijan?
Yes, 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 absolutely. It makes sense. Thank you.
Yeah.
Okay, great. Ruben, can you unmute yourself? All right. His question is,
Yeah.
how do we
How
come
do
up
we
with a
come up
proper
with the
research
proper research
question?
question, right? I
Yeah.
Is it okay if I avoid this question, answering this question, because it actually needs a different session, talking about PCOT or PCOT format, and it will need some time to explain. But just you can Google it if you want, Ruben. Like there are various, and this is for everybody else. Actually, in fact, YouTube is a wonderful resource. Like and there are many free courses as well, but YouTube in fact is a very good resource where you can really learn a lot of things, how to use your statistical softwares and all of that. So please use it at your discretion. Use it at your convenience and will, and you will learn a lot. And for this, just search how to frame a research question, or PECOT format, PICOT or PECOT, and you will your answer will be, your question will be answered. Otherwise, it will need some time. Then Mihir, can you answer your sorry question? Ask your question by unmuting, please.
Yeah, hello, am I audible?
Yes, you're audible.
Yeah, so I was asking like I have done my data collection for the study, and then I found it that it came out to be insignificant. Like
All
the
right.
at the end, I can't apply any of the statistical test because of that insignificant data. So what to do in that scenario?
So I hope this is the hypothetical scenario, because if see there's a difference. One thing is not being able to apply any statistical test, and second thing is your results are coming as statistically insignificant. All right. So the first thing is The first thing is scary because if you are not able to collect data on which statistical tests could not be applied for an analytical study, then it's a scary situation where you might have to redo your research. And first of all, it should not have passed on the ethics committee check by itself. All right. But even in that case, you can publish your findings as descriptive findings, that just publish it as what do you say, your in terms of mean standard deviation or median interquartile range for you know again, that is statistics, but yeah, basically in terms of your means and central tendencies and dispersions and your percentages for categorical data, and the earlier one for this quantitative continuous variables. So basically, you can share the findings as a descriptive study uh, if you cannot apply the statistical tests. And I'm assuming that you're talking about what if this has already been done, but we will always take care that this should not happen. Like, consult a statistician. Don't be scared to consult again. All right. And like or somebody in your possibly community medicine department, or somebody would know, right? Some seniors. So take guidance. I'm again saying, like, feel free to take mentorship. Like, there are people who are eager to, teach you all. But whereas if you're seeking mentorship, please be enthusiastic about and respectful to that person of that time and all of that. Whereas the second scenario where you are able to perform statistical tests, but the findings are insignificant, you can still publish. It is still valid to publish insignificant findings, or this is called a negative finding study, wherein you find that it is not significant, like your hypothesis or your what you had thought is not correct. But isn't that science to, like, if to, like, that is about you should publish it, because actually there is a publication bias in general, that people only with positive findings publish. But that shifts the, when somebody is doing a systematic review, as somebody rightly asked, it would cause collective findings. It might what do you say, give us the wrong findings if you don't publish the insignificant findings. So negative finding studies should be published. All right, but again, you should write the manuscript well to say how your methodology was great. All right, so always before the study focus on your methodology. After the study, uh, like just try to, solve it how I told. All right, Mihir, did you is your question answered?
Yeah, yeah. Right.
And UG is Raju is asking, can UG just like us write as literature review and publish it? Yes, of course. Why not? Like, you can write a narrative review, you can write a systematic review, but make sure that you do it correctly and get guidance. For example, I recently saw a poster presented in a conference where it was told to be a systematic review, but it did not follow guidelines like Prisma guidelines. It did not. She had no guidance or whatsoever. She was the sole author on that, and like the findings were not it was not even a systematic or it was not even a narrative review. It might be a scoping review at the most. But yeah, so basically, you can do a literature review, you can do reviews, but do it uh, with guidance to begin with, and then you can, what do you say, you can once you learn, you can do it on your own, and in fact you can teach others. Keep on what do you say, passing on the baton. So that is very important. So is your question answered?
Okay, so anyone, any other question?
Last question, if any.
You can, like, you can feel free to unmute yourself. We
Yeah.
can still accept one or two questions.
I apologize for rushing through the PPT and all of that, because there were a lot of things to talk about, but I tried to make it as simple and as friendly as possible, and while being very what do you say, while sticking to the topic and sharing whatever I could in this small time. And thank you so much for joining.